Okay, so this patient is here for double eyelid surgery, and you could see that she has excess skin hooding here. And also you'll notice is that her eyes are kind of puffy, and that her eye muscle is slightly weak. So when she open your eyes a little more. Yeah, she tends to kind of open with her eyebrows a little more closed. Okay, open. Yeah, so you can see how the left eyebrow kind of moves. And so again, if we did a double eyelid, close your eyes. Let's say this, if we do a kind of a small fold, open. It's kind of small, close. If I do a bigger fold, open, it's too big. So her optimal fold is close, open. So this is her optimal fold, but you could see that she has excess skin kind of coming down. We want to remove some of the excess skin without having to close, open, without having to do this big fold on her. And at the same time, what we're going to do is we're going to do a ptosis correction so that she could open her eyes better without her having to raise her forehead as much. So she's a great candidate for an incision technique rather than a suture technique, which is a non-incision method, so that we could remove the skin. Now, just to be clear, I mean, the suture technique or the non-incision, we could still remove the fat. So it's not the fat is not the reason why we're making an incision on her. We're doing an incision to remove the excess skin. And when we're removing the excess skin, we're also removing the orbicularis oculi muscle, which is just underneath the skin. So that's the superficial layer of the muscle. So we're also getting rid of the excess weight. So by getting rid of the fat, by getting rid of the excess skin and the muscle, that mass effect, getting rid of that weight, will help her open her eyes better, in addition to the ptosis correction, which is going to also give more power for her to open her eyes. So she'll look more brighter and more alert, and easier for her to open her eyes. So if you look at her eyes also here, the corner, this corner, her patient's left side, this side corner is going more straight out this way, whereas this side is coming down more downward, more in an oblique downward angle. So what I mean is that this is coming down more this way, whereas this is coming down more this way. So if you're looking at, if I pull, you'll see that this side is pulling more, it has more downward traction. And that's because she has an epicanthal fold on the patient's right side. This is her right side. She has more of an epicanthal fold, whereas this side she doesn't. So she wants to correct that. So we will be doing a slight epicanthoplasty on this side, so that on this side, when the fold is done, close, open. So you see the fold wants to come out more as a slight parallel, whereas close, open, this wants to kind of come in this way. So by doing an epicanthoplasty on this side, it would even it out. And also you'll notice that the distances here is shorter, whereas the distance from here to here is longer. So by doing an epicanthoplasty, we'll even out the distance as well. So every time she opens, open more, she raises her eyebrows a lot. So by, as I mentioned, by doing a ptosis surgery and doing a double eyelid surgery, getting the weight off of it, it will also help her open her eyes better. So hopefully she doesn't develop wrinkles on her forehead.
Already there, but yes, more wrinkles.
More wrinkles, okay.
Deeper wrinkles.
All right.